Hello, I am Dr. Evonemo Esievoadje, and I'm here to talk about my leadership project with the WomenLift Health Program. Just going to share my screen. So I'll be talking about improving gender equity among Nigerian adolescents with an emphasis on sexual abuse. To give context to this topic, adolescents worldwide are frequently affected by sexual violence, with immediate consequences for survivors, including pregnancy, sexually transmitted infections, like stress disorders, poor relationships, and then future consequences such as a triple risk of even more sexual and physical abuse as adults, and then chances of becoming perpetrators, as in carrying out sexual violence on other children when they are adults later in life. Unhealthy behaviors with substances, like becoming addicted to different substances, unhealthy behaviors with sexual activity, as well as negative gynecological, somatic, and psychological outcomes such as chronic pelvic pain, problems with fertility and childbirth, post-traumatic stress disorder. And then I have some horrifying statistics here. Research has shown that with for girls, approximately 8% to an estimated 8 million has experienced rape or attempted rape, and for boys, that's 0.7%. And then we also see that for girls, about 4% of them have gone through rape or attempted rape under the influence of drug or alcohol. And then for boys, this is about 1%. We have even more horrifying figures from Nigeria, where polling 1,688 adolescents by the Young Doctors Forum of the Medical Women's Association of Nigeria, where I was the national coordinator, show that 36% of young people under the age of 19 have been sexually abused. Put that into context, that's approximately one in every four young person on the streets in Nigeria has been abused. Why is there such a high prevalence in Nigeria? And that is why this project was chosen. One, because of the culture of silence. In Nigeria, young people are encouraged to respect their elders, respect anyone older than you, and not to speak up or not to like confront them when they do things wrong. Interestingly, in the year 2020, there was a protest by young people against against armed forces and the police terrorizing them. And the slogan for that protest was called Sorosoke, a Yoruba word that means speak out. So young people were encouraged to speak out against all forms of abuse. There's also victim shaming, where the victims are told that they are responsible for whatever happens to them. And this could be in situations whereby the victims are told so they were abused because of the way they dressed, because of a certain way they looked, or because they're in a certain place at a certain time. And then we see that perpetrators are not held accountable. Perpetrators are not often not made to face the law. We have families who accept to settle sexual abuse out of court, or the perpetrators come in and they apologize and beg the family, and then sometimes they pay money just to make this go away. And so you have perpetrators who abuse one child and then go on to abuse another because they were not held accountable. Interestingly, in 2021 or 2022, a rape registry was established in Nigeria where offenders would be have their names and pictures published. But so far, I haven't seen any definite change come out from that. And then also inadequate health literacy. You have young girls being told that if they do not have sex at a certain age, they would not be able to get pregnant or give birth. You have young girls with acne who are told that they have acne because they have never had sex. And so they are coerced to have sex just, to get rid of their acne. So for things like this, it's it leads to a high prevalence of child sexual abuse. So what was done in the last year? So there was education of the adolescents at the time of collection of data. There was health literacy education. There was education and encouragement to speak out. There was encouragement to speak to trusted ones. There was education also that because one of the things we found out was that family members were mostly responsible for abuse. So it was people these young children knew, family members, teachers, religious leaders, neighbors, or nannies. So we're encouraged to speak out and speak to people and stop the violence. We also plan to disseminate the results of this research at conferences. So an abstract will be presented at the 11th edition of the African Conference on Sexual and Reproductive Health Rights and Family Wellbeing in Morocco, which will be holding on February 24th to March 26th, a few weeks from now. There's also plans to publish this research in the bulletin of the World Health Organization. What have I learned from Women's Lift Health that was applied to this project? I've learned that speaking to different leaders at different levels can make my project and make my work go faster than if I can accomplish alone. I have learned my influence style and have used that to work with people to get this project accomplished. And I've also learned that advocating requires allies and that I cannot do this by myself and I need different people on my side to work. And then finally, I want to thank everyone for listening to this. And I want to thank God for this opportunity to be part of the Women's Lift Health. It has been an amazing journey. It's something I'm grateful for. I also want to thank my husband, Dr. Esievoadje, who's here listening to this, who has been supportive all the way when I come up with harebrained schemes and things I want to do that I think would advance my career. He has been very helpful and supportive. I thank my parents, Mr. and Mrs. Andrew Laurie, and my six sisters. Because I come from a family of just girls, we are seven girls in my family. I've had a strong affinity for the rights of fighting for the rights of females all over the world.